if you are failing NCLEX question, this is why. Now, most students fail NCLEX practice question not because they don't study hard, but because they miss this life-saving priority clue hiding in the answers. Now, I will share you 5 clue, and these 5 clue, they always scream what? They scream pick me. So when you see this clue on the NCLEX, just select that particular answer. That answer is correct. Now, clue number 1 for airway. Clue number 1 for what? Airway. Now, if you see statement like stridor, pick the answer. If you see statement like choking, pick the answer. If you see statement like reason, pick the answer. All these are high priority on the NCLEX exam. Now, 2, let's talk about changes in level of consciousness. Now, if you see statement like confused, pick the answer. If you see statements like drowsy, now drowsy and maybe the patient condition is related to a neurological issue, and it shows the part of the question is saying something in regards to that patient being drowsy. Select that answer. Now, if you see something like statement like suddenly unresponsive, pick the answer. Right, that is for level of consciousness. Now, 3, active bleeding. Now, a lot of students make mistake with bleeding. Right, active bleeding or sign of hemorrhage. Now, a lot of students make mistake with active bleeding. Active bleeding, when you think about active bleeding, think about we cause something to make the patient to bleed. Like there's something that is causing the patient to bleed. It's not natural. You understand what I'm trying to say? Think about it's not natural. Now, if the NCLEX is saying something like heavy menses, and the NCLEX is saying another statement, the NCLEX is saying anticoagulant, right? And then patient is what? Bleeding. Now, this is active bleeding. This is not active bleeding because this is natural. This happen. So in order to evaluate the bleeding right here, we need vital sign to find out if this patient is having problem with this heavy menses, because this is natural. The menses is natural. Unlike anticoagulants, we use this to cause this, so this become active bleeding. Another form of active bleeding is what we call post-op. Right, post-op patient, form of active bleeding, or your postpartum hemorrhage, something more than 500 ml for normal vaginal delivery, and then 1000 ml for your C-section. Now, other aspect of bleeding is like you are bleeding from the head. Now, when you are bleeding from the head, it must be deep to be considered priority. If it is surface, no. Surface is not a priority. Or NCLEX can just say scalp. Right, that's not a priority. So bleeding from the head deep, except if the NCLEX is not like saying anything about deep or surface. If the NCLEX just say bleeding from the head, trust me, priority. Right. Okay. So I think that's that for that. Now, you might, okay, let me add one to it. Now, maybe bleeding from IV site. Now, this is not a priority because all you just need to do is to apply what? Pressure, and the bleeding will stop, because that is a small bleeding area that once you just apply pressure, it's gone. So yeah, that's just an extra bonus. Now, okay, let's talk about number 4. Number 4. Now, let's talk about fever. Now, a lot of people prioritize fever wrong on the NCLEX exam. Right, this is how NCLEX wants you to prioritize fever. Now, we prioritize fever from unknown source. We prioritize fever from what? Unknown source. Now, if a patient is having fever and their condition is COPD, this is what we call unknown source. It's unknown, right? Unknown. Now, fever, COPD is a patient with COPD should not experience fever. You prioritize this. Now, but if the NCLEX is saying fever and the patient is having what? Pneumonia, right? This you prioritize because no, we don't prioritize this. I mean, now because this is known source, we prioritize unknown source on the NCLEX exam, right? Because yeah, it's expected this is an infection, right? So if NCLEX is saying UTI and the NCLEX is saying fever, and you have COPD fever, you prioritize this over this because this is known because UTI is an infection. So know that, right? Another thing you want to know is that there are some you don't need to even think about it. Now, if you know that a particular intervention should not cause infection, just prioritize it. Now, use of chemotherapy and patient present with fever. This is our priority. Select the answer on the NCLEX exam. Or from invasive procedure, patient have fever, priority. Most especially if an intervention, right, cause fever, you want to prioritize that. Any kind of intervention, right? So select those answers. Those answers scream, pick me, pick me, pick me, right? So, now last bonus I'm going to give you is fever with surgery. Now, fever within 24 hours is not a priority. Not a priority. But fever after 72 hours, let me say 48 to 72 hours, this is a priority. Pick the answer. Right. So yeah, basically I feel okay. All right. Now let me give you the last one. Pay attention. Now, the last one is all about keywords. NCLEX like using keywords very much. Now, when you see this certain keyword, don't overthink it. Pick those answers. Keyword when the NCLEX is using sudden, or the NCLEX can say suddenly, onset, new, recently, experiencing, suddenly onset, new, recently experiencing, right? Or maybe new admission, right? New admission, yeah. Suddenly onset, new, recently experiencing, new admission. This keyword, they are 100% priority on the NCLEX exam. You don't need to think about it. Just select that particular answer. Right. These are your golden keys on the NCLEX exam. Right. You don't want to pick answers based on emotion. You want to pick answer based on urgency on the NCLEX exam. So this is what you should use on the NCLEX exam. Apply it, right? Always apply it. Now let us do a sample question. Let us say the NCLEX is testing us on a client, right? A client with pneumonia, who becomes confused, right, and restless. And the NCLEX is now asking you, what is your next step? Now, this is your NCLEX question. A client with pneumonia become confused and restless. What is your next step? Now, let's say your number one option is reassure client to check O2 SAT. 3, call the healthcare provider. And then 4, give fluid. Now, what would you say your answer is? A client with pneumonia become confused and restless. Look at the keyword right here. Now, what is your next step? The patient is having serious problem. So the NCLEX is asking you, are you going to reassure client? Obviously, no, because this patient needs care now. Are we going to call the healthcare provider. I want you to know something on the NCLEX exam. The NCLEX exam is a nursing exam. So NCLEX wants 90% of your answer to be, or how do I say it? Now the NCLEX wants 90% of the solution you are giving to the patient should be from you, the nurse, rather than the doctor. So this, I will just say, I can wait on this until I see a certain answer. Maybe I'm not seeing any answer I can select yet. Then I just need to wait on this. Now, give fluid. Now, I need to ask myself, why do we give fluid? Right, with fluid, solve this, with fluid, solve this. Right. So this is a neurological issue. If I'm thinking about a cardiovascular issue, maybe this. But this is a neurological issue. And the only answer I'm left with right here is definitely this. Right. 2. So 2 is the correct answer. You need to check oxygen, right? Because this clue you have right here, confusion, restlessness, that is a sign of oxygen issue right there, and you just want to answer the question accordingly to what the patient is experiencing. Now, I want to give you something for staying to this point of the video. Now, if you want my full, I want to give you my full NCLEX priority cheat sheet. Right. Then I will give you 10 more clues that you need to know. I'm going to give you 10 more clues, and I'm also going to give you practice questions. Right. I'm going to give you what? 10 more clues and practice questions. I gave 5, but I'm going to give you 10. So that would be like 15. Right. So if you want this, all you just need to do is to text me right now. My number is on the screen. +1 767 613 0769. I'm giving this to you for free. All you just need to just text me this keyword. Right. Just text me this keyword. Clue. Just text me this keyword, clue. Right. Just text me clue. I will understand what you want. Then I'm going to send it to you for free. Right. Clue. Text me this keyword, clue. I'm going to send it to you for free. Right. So you can have it. So yeah, that is it for the video. If you enjoyed this video, share, like, to anybody if you will need the videos. Follow me on Instagram for more video as well too, and then I will see you on my next video.